speaker. No.
Well, welcome everyone. My name is Brian McGovern. I'm the CEO of NJCRI. Welcome, Governor. Welcome, Assemblywoman Ms. Gates. Spate. I'm sorry. And welcome everyone else to NJCRI. Today we are here for some exciting news from our Governor Phil Murphy that will build on the work in combating opioid crisis with strategies, investment to further the reach and impact to critical lives-saving programs. We are honored here at NJCRI to have this announcement done at our organization. NJCRI is a harm reduction full-service organization. Our primary purpose is to serve the individual where they are by engaging people who are dealing with harmful behaviors such as substance use and equipping them with life-saving tools and information to create a positive change in their lives. At NJCRI, some of the tools we use include a drop-in center for people without residence, food pantry, opiate treatment, life-saving, domestic violence, advocacy and placement, mental health, medical care, and substance abuse groups. We also provide, we have seen positive impact of these services, so many struggling, which is why it is exciting to hear about today's announcement and the funding that comes. Harm reduction is not a philosophy. It is a science with an evidence-based approach. Too often we provide family members, the provider, family members, and the community have our agenda how someone should be treated. Harm reduction, there is no one approach. Together we prevent and recover treatment, housing, support. We are being uplifted with today's announcement. Harm reduction will help individuals create their path and goals. Empowering them to be their own captain to steer away from unhealthy behaviors and situations, choosing healthy alternatives. I'm excited New Jersey is looking at the complexity of the whole person. So as I have said, we should start where the individual is, meet them in the street during their crisis or homeless situation. I thank our governor to come and make this announcement here where the people are. With that, I'd like to introduce Governor Murphy.
Thank you, Brian, for that very kind introduction, and I love the notion of the complexity of the human being and meeting people where they are. Two themes that I think are consistent with our approach from day one and very much consistent with the work you do here and also the announcement we're going to make today. But incredibly grateful to you and your team at the North Jersey Community Research Initiative and all the work that you do and so many here do every day to expand access to life-saving health care. I might add, we have a sold-out crowd here. I don't think we could get another body in this room if we tried. And good morning to everybody, and thank you very much for joining us in the Brick City. And Shanique Spate was referred to earlier, Assemblywoman. It's always an honor to have you here in your hometown. So we're here today to announce a historic investment into our efforts to combat the opioid crisis in New Jersey, and at the same time help our neighbors struggling with addiction to find their path to recovery. I'm joined by a number of important folks this morning, in addition to Brian and his team, these include some of the state's great champions in this effort. Immediately to my right is the Commissioner of the Department of Human Services, Sarah Adelman. Sarah, great to have you. And we have your Deputy Commissioner, Valerie Mielke, here, who oversees the Division of Mental Health and Addiction Services. To Sarah's right is the Acting Commissioner of the Department of Health, Dr. Caitlin Baston. Kate, good to have you. And To Brian's right, the Deputy Director for Newark Community Street Team, Solomon Middleton Williams. Great to have you with us. Newark Community Street Teams is let's go, we can hear that, is a great partner of ours across so many fronts. I also want to note that Solomon is a member as well of the Opioid Recovery and Remediation Advisory Council. I want to thank him and all of his fellow council members who are with us this morning. You've done extraordinary work, and each one of the council members has shared their expertise and provided invaluable insights into saving lives from substance use disorder. And it is thanks to their recommendations and insights that today I'm honored to announce that we will be investing over $95 million over the next 3 years into a range of evidence-based strategies to expand care and support individuals in recovery. And this over $95 million sort of comes in 6 buckets: harm reduction center expansion, community peer recovery center expansion, medication-assisted treatment, or MAT, expansion, New Jersey Keeping Families Together expansion, rapid referral platform for low-threshold MAT access, and lastly, housing continuum for folks with substance abuse disorders. Those are the 6 buckets, and each and every one of them is important. And importantly, the funding is not coming from the pockets of New Jersey's taxpayers. Instead, this funding is actually coming from settlement payments we are receiving from the opioid industry itself as a result of our litigation against them for creating and then fueling the opioid crisis. Over the next couple of decades, our state stands to receive more than $1 billion from opioid manufacturers, distributors, and pharmacies. And roughly, importantly, half of that amount will go directly toward our counties and local governments, so these funds can be spent quickly on the front lines of our communities. And today, we are putting some of the earliest settlement payments to use by, as I mentioned, investing in new programs on the one hand and expanding proven strategies for saving lives from opioids here in New Jersey on the other hand. We have been focused on this issue since day one of our administration. And just last month, we received word that the number of suspected drug overdose deaths in New Jersey declined from 2022 to 2023, which is a good thing. A number of deaths that was over 3,000 to a number of deaths that is under 3,000. But just think about that. These are each and every one of them precious lives, and those numbers, anything north of 0, is unacceptable, and we have to stay on this journey together. But we also have to acknowledge important progress. But just as importantly, I think it is proof that expanding support for our neighbors struggling with addiction, rather than throwing them behind bars, saves lives and improves community health more broadly. That is why the nearly $100 million investment we're announcing today will increase funding, as I mentioned, from everything from harm reduction initiatives to addiction prevention and treatment programs to housing continuum and beyond. And with this investment, we're going to bring these programs and initiatives to more communities than ever before, especially our Black and brown communities, which now are tragically increasingly impacted by the opioid crisis. So today, New Jersey is taking a momentous step forward in putting the evidence-informed recommendations offered, I might add, by many of the experts here with us this morning into practice. And a kind of a phrase that I think does not meet the moment, but I also want to say for the folks who may be paying attention to this for the first time, that this is a so-called Moneyball approach. Brian alluded to this. We're not guessing. The experts here aren't guessing. We know what works, what doesn't work. We're doubling down on what does work. We're expanding into other areas that are new initiatives that we also know work. I highlighted that we're going to expand harm reduction services throughout our state, and that will help prevent opioid overdose deaths and make life-saving health care services more accessible. This will be, by example, an immediate $24 million infusion into centers authorized up and down the state. At the same time, we're going to significantly expand access to treatment centers and recovery programs so our neighbors struggling with addiction can find and remain on their path to recovery. And in that same spirit, we're going to increase funding, again, as I previewed, for housing and support programs so these same individuals can access substance-free living environments on an emergency or a short-term or transitional or permanent basis. And crucially, we know that the disease of addiction does not only cause harm to the individual, as we have seen far too many times, it can tear apart entire families and even communities. And I mentioned this as well, that is the reason we're increasing funding for programs like Keeping Families Together, which is a partnership between the Department of Children and Families on the one hand and the Department of Community Affairs on the other hand. These are both at the state level, to provide, housing assistance and trauma-informed care to families in need. And finally, we are also going to continue addressing new threats like fentanyl mixed with tranq. We're going to drive critical supplies out to our communities, including wound care and hygiene kits. And thanks to legislation enacted in January, Shanique, thank you for that as well, drug testing supplies to the communities as well. So altogether, with this bordering on $100 million investment we are announcing today, we're expanding support for everyone impacted by the opioid crisis on an individual, family, as well as community-wide level. And unlike the failed war on drugs, the broad-based, expert-informed approach we are embracing with today's announcement will help our state meaningfully push back on the opioid crisis and save many more precious lives. So once again, I want to thank everyone here for doing their part to build a more compassionate, humane, and effective system for saving lives and healing our communities. With that, there's no better or more important leader in this fight than the Commissioner who's with us today of Human Services. Please welcome Sarah Adelman. Sarah.
Good morning. Governor, today's announcements and this milestone in New Jersey's efforts to combat and recover from the opioid crisis would not be possible without your leadership, so I thank you sincerely. This is an incredibly important moment for me personally as well as professionally. This isn't something I talk about a lot, but I have lived every day of my life impacted by addiction as the daughter of someone who struggled with substance use and for years with opioid use disorder until I lost them from complications from addiction. Recovery and sobriety are difficult, and as a child and later as a caregiver, I have experienced the hope and devastation that comes with the high and low points of that journey. And I have witnessed and felt acutely the impacts of stigma and shame that take their toll and rob people of their dignity. It is heartbreaking, it's not right or just, and it is so much worse knowing that there are people, and many people in the healthcare industry, who perpetuated this crisis for profit. So I am deeply grateful for Attorney General Platkin and our colleagues in his office for their work to hold these parties accountable and to bring back more than $1 billion in settlement funds to New Jersey. These investments we are announcing today would not be possible without the work of the Attorney General's office. There will never be enough money, and it will not bring back those we have lost, but these funds will help us to serve those who are still here. So just as I began, this is an important moment for me personally and professionally because today New Jersey is announcing our initial round of opioid abatement and remediation funding. My personal experience with this crisis is not unique, not in this country and not even in this room. So I am and have been deeply humbled to serve as chair of the Remediation Advisory Council. And I want to take a moment to acknowledge my fellow council members, many of whom are in the room with us today, and to thank you for your dedication and contributions to New Jersey. So Mavis Asayadu from Pong, from the Walter Rand Institute for Public Affairs at Rutgers, Bree Azeniedo from Black Lives Matter Patterson, Dr. Robert DeTore from Turning Point Inc., Jenna Miller from the New Jersey Harm Reduction Coalition, Solomon Middleton Williams from the Newark Community Street Team, who you will hear from shortly, Dr. Amasika Nyaku from the Rutgers Medical School and a board member of our host organization today, Sherla Simpson, Burlington County's Director of Human Services and Mental Health Administrator, Brian Thompson from the Camden Coalition, Morgan Thompson from Prevention Links, and Dr. Deborah Wentz from the New Jersey Association of Mental Health and Addiction Agencies, as well as our ex officio members from the Departments of Children and Families, Department of Health, and the Attorney General's Office, and the members of my team at Human Services and the Governor's Office who have supported this council's work as we've met over the last year. So let me finally get into it. As you've already heard, New Jersey will receive $1 billion over the next 2 decades to be spent addressing the opioid crisis. About half of this funding will be available for state investments and half for local government subdivisions. Not a dollar will be spent filling budget holes or potholes. These funds must be used towards the opioid crisis, and they must supplement and may not supplant existing opioid funding. The approximately $100 million in funding announced today will support projects over the next 3-year period, but these funds represent only the first set of proposals to be recommended by this council. We are in the midst of developing a strategic plan supported by Montclair State University's Center for Research and Evaluation on Education and Human Services, and this strategic plan will serve as a roadmap for spending decisions and evaluation of the programs over the next 2 decades while New Jersey is receiving and spending settlement funds. Our council has heard from hundreds of individuals at our 5 public listening sessions and through the online portal, and we are so appreciative of the passionate pleas and the priorities that members of the public and experts from around the state have shared with us. All of the spending proposals submitted to the council will continue to be considered and evaluated. And with that, I am pleased to share that the initial release of funding announced today, as the governor previewed, will provide $24 million to harm reduction expansion activities to better meet people where they are, $17.5 million to support community peer recovery centers, which are safe and welcoming places for individuals ready to receive support for their recovery, $9 million to expand mobile medication for addiction treatment, which is an effective, low barrier, and evidence-based strategy, just over $8 million to enhance the New Jersey Keeping Families Together program, because just as the governor said, addiction affects entire families, and supporting individuals with housing and case management and community and therapeutic services helps support both an individual's recovery, but also to meet the needs of their entire family. $19.5 million to create a rapid referral platform for low-threshold medication access for opioid use disorder, which is another effective and evidence-based strategy. $17 million to develop a new continuum of housing supports in the Housing First model for individuals with substance use disorder, from shelters to recovery, to supportive recovery environments, rental assistance, helping individuals find permanent housing, and all of the supports needed along the way. And $500,000 from our Opioid Crisis Emergency Response Fund to purchase xylazine test strips and other critical supplies, which Commissioner Baston will speak more about. So on behalf of the council and on behalf of New Jersey Human Services, we are eager to see the positive impacts these investments will have in our communities. We will continue to recommend spending, strategies, and priorities that offer us the best chance to end and recover from this crisis with empathy and compassion. To review the details behind our proposals, please visit nj.gov/opioid funds. That's nj.gov/opioid funds. Thank you.
Sarah, I would just say, you have not spoken about your private, personal reality much, although you and I have talked about it. But in both your personal and professional capacity, this group could not have a better leader. So bless you and thank you. Please help me welcome another great leader in our cabinet, the Acting Commissioner of the Department of Health, Dr. Caitlin Baston. Kate.
Good morning. Thanks, everyone. It's wonderful to see some familiar faces out here in the crowd today. As many of you know, I'm a family physician and an addiction physician. And so I've been working in this field for the past 8 years in New Jersey prior to coming to this role in Camden, New Jersey, and across South Jersey. So I'm very thankful. Like many of you, this is a long-awaited moment for me. And I just want to take a moment to thank, as was done, but thank you, Governor, for your leadership in this space and for giving it the light it deserves. Thank you. Thank you to my friend and colleague, Commissioner Adelman. We could not do this without partnership, and we are doing that incredibly right now, and it means so much because it's what's getting all of this across the finish line. And thank you to all of you, the members of the council, many of whom I know and have worked with personally before this current role, and to the people who showed up time and time again for the people that are suffering on the front lines from this disease. Because for those of us in the field, working in the field, we have made progress. As the governor said, we are starting to flatten the curve. But unfortunately, one of the things I want to highlight is that while we are flattening the curve for some, we are not flattening the curve for all. And as we've seen the numbers drop off for white New Jerseyans, we've actually seen them continue to rise in the Black and brown communities in our state, which is unacceptable. And we're seeing disproportionate amounts of people really affected in rural areas and staggering numbers in the elderly population. And so I say all this not to be depressing, but to say we have work to do, right? And that is why we are here. And the good news is that we have tools that work, and overdose deaths are preventable. These are preventable diseases. And so the reason this is so important to me, that we are focusing in these specific evidence-based strategies, is that these are what work. And what you're hearing about this morning is a coordinated, statewide approach in these three big buckets: in harm reduction, in medication, and in housing and recovery supports. That is the continuum, right? That is how we actually start making a difference for these folks that are suffering on the front lines, getting evidence-based treatments into the hands of people who need them. So there are two major investments I'm going to focus on that the Department of Health is going to help get out into the communities. The first is harm reduction, as you've heard a bit about, and the second is medication. And in the harm reduction bucket, you've heard this morning, $24 million, which is a historic amount being invested in harm reduction services across the state. And this means practical, tangible treatments that people are going to get. That includes keeping them alive, right, with emergency naloxone. It means the kinds of services that prevent infections and keep people out of the hospital or worse, death from these illnesses. It also means creating spaces that are open for people to walk into anywhere. The reason they're so important is that our folks know, the people who use drugs and the people that are struggling in this community know that they can walk into places like this one, no matter how they're showing up that day, and that they are going to be treated with dignity and welcomed with open arms, that they are going to be kept alive with the services that they're offered, and that compassion and connection they're getting that day is the critical first step to them believing that for themselves and then taking that next step. So this is the base, right? This is not big news, fancy, exciting. This is the floor. And we are now going to get that all across our state, everywhere. And I'm excited that as of this morning, the Department of Health just approved 2 additional harm reduction centers, which gets us up to 18 out of 21 counties. My goal when I got here was to make sure there was at least 1 harm reduction center in every single county in the state. We are going to blow that goal out of the water. And I want to be very clear that that means that this will be available for our loved ones, whoever they are, right? Our brother, sister, uncle, best friend, daughter, son. Those people will be able to walk in to somewhere the day they need it, the minute they need it, and be welcomed with open arms anywhere in our state. So this is incredible. And as was mentioned, we have, thank you to the council, dedicated specific funding to meet the needs of the community right now. We have heard you. We know there is xylazine or tranq in the supply. We know that is creating devastating wounds. And we are dedicating that money to wound care and to getting harm reduction supplies and drug testing supplies out into the community. So we are very thankful that we have that funding. The Department of Health is hopeful to get that out this spring. So harm reduction, of course, is that first step, right? That's what we're blanketing the state with, that first step. But that next step, or that next bucket that I talked about, is medication, because it's advanced medical treatments for this disease that is the absolute necessary next step for anybody struggling. And I will tell you, as a family physician, we don't approach anything else in medicine the way that we've approached addiction. If somebody has heart disease, if somebody has a heart attack, and they wind up in a hospital, in my hospital, right? There is an actual code called. People come running out of the back. There is a whole protocol and procedure. You get medications in a certain amount of minutes. If you need a procedure, you are whisked away to that procedure within 30 minutes. There is an intervention done to save your life. Then a team wraps around you, makes sure that you're admitted to the hospital, you're stabilized on the medications you need, you have all the discharge medications and paperwork and a cardiologist, and the whole nine is thrown at that problem. The medications we're talking about for opioid use disorder, like methadone and buprenorphine, decrease mortality by 60%. That is way more than many of those heart disease medications that I just mentioned. And so as a physician, I am excited for the day when an overdose is treated with that same amount of vigor in medicine. Someone comes in with an overdose. That's right. A team comes running out of the back, right? They are given medication. They are surrounded by people who are caring for them. They have all the information that they need. They are set up immediately with medications and an appointment and people who care about them. And they're going to get the trauma-informed wraparound care that they need to not just survive, right, but to thrive. And that is why that medical treatment is critical. And it works. And we have it. And so the Department of Health is using a statewide platform that was mentioned, because this platform can be in the hands of all the first responders or anybody on the front lines of this and connect people immediately to harm reduction, to medication, to a 24/7 telehealth provider. That platform uses transportation and medication gap coverage to get at the barrier so that people can actually get that medication that we're giving them on the other side. This platform has been proven to work, and the reason it's incredible is that we can get it anywhere in the state. We're hopeful to launch it soon this year, but anybody who's been on the front lines knows that you can't see somebody across from you who is asking for treatment and say, okay, I'll put you on a wait list, or here's a couple numbers to call, right? 30 days of waiting is too late. 30 hours of waiting, 3 hours of waiting is often too late. If somebody wants that help, they need that help in that moment. And this means that whoever that first responder is, whether it's EMS, whether it's a peer on the front lines, whether it's a treatment program, whether it's a school, you can have this platform, you can see somebody who's struggling or talk to somebody who you know is struggling on the front lines and say, I have a tool that can connect you to treatment right now. That's incredible. And so we are doing this so that everybody in the state is going to have access to this platform. And as you heard, kind of the third pronged approach to this, which is the community centers and the housing and the long-term supports, we are going to partner so that that is there to help these people in the long-term recovery. We're going to meet them where they are. We're going to get them the life-saving medication treatment they deserve, and we're going to wrap around them in those recovery supports. This is, as I like to say, playing the tape all the way to the end. Right? It's not reducing an overdose, reversing an overdose, and then handing somebody numbers. It's the next step, and the next step, and the next step. And it's what our community deserves. Although I will say, I'm realizing that I'm dating myself with that reference of playing the tape all the way to the end. I said it to my kids recently, and my 6- and 8-year-old daughter were like, playing a tape? What's a tape? Right. Correct. It's not, they're like, sticky tape? No. So I have to work on my analogies, and I recognize that. I'm aging myself, TikTok, streaming, I don't know, I'll get there. But the reality here is that I know that these investments for those kids 10 years down the line, when they are 16 and 18, when they are teenagers, we are going to be thankfully dealing with some different crisis. That they don't have to lose 1 in 10 of their friends, or, gracias a Dios, they won't have to lose one of their own lives to overdose, because we are going to blanket this community with the treatments and the prevention that they need. So I will leave you with the final words that were my inspiration of the day. Actually, just as I was streaming NPR this morning, I heard our poet laureate Amanda Gorman reading a poem, a very inspirational poem, to the background of Bach, like kind of the devastating sounds of Bach. And that juxtaposition just felt so right for this moment, right? It's inspiration against the devastation that we're feeling and seeing every day. And I'll leave you with her final words, which I'm feeling from this event this morning. For whenever we come together, we will forever overcome. Thank you.
I love our poet laureate. Tammy and I sat outdoors when President Biden was inaugurated, and you may remember that she lit the place up. She was the star of the show. Your tape and references, I cracked a Wayne Newton joke the other day, and I realized in a room of several hundred, there was probably one other person who the heck is Wayne Newton? So I'm with you. Kate, thank you so much for your leadership as well. You and Sarah are as good as it gets. And Sarah mentioned in absentia, we owe the Attorney General and his team an enormous debt of gratitude because they have clawed and scratched and gotten this money back into our ledger, and we wouldn't be here today without those. We'd be doing, amen. We'd be doing some of this, but it would be on the state's back, and the fact that the perpetrators are paying for this is a bit of sweet revenge, I think, for all the tragedy they've caused. Last but not least, a member of the council. I referenced him earlier. Please help me welcome an outstanding individual. He works in another organization that we know well and do an enormous amount with. Please help me welcome Solomon Middleton Williams.
Wow. Good morning, everyone. My name is Solomon Middleton Williams, and I serve as a proud member of the New Jersey Opioid Recovery and Remediation Advisory Council. And today we have an honor of presenting, as you guys heard already, our recommendations to alleviate the devastation caused by the opioid epidemic in our state. And before I continue, I want to extend again a heartfelt thank you to Attorney General Placken, Commissioner Adelman, Acting Commissioner Baston, the members of this council, the hardworking people of New Jersey, and the Governor Murphy for your unwavering leadership in addressing this crisis. The commitment to undoing historical wrongs provides the strong foundation for this council's recommendations today. I just want to say that these recommendations are not pearly words on a paper. They are the results of countless hours of listening, analyzing, and debating. And we held public sessions to hear directly from New Jersey residents most impacted by this crisis. Behind closed doors, we rigorously examined data, evidence, and real needs of everyday residents of New Jersey. This council worked hard to ensure the voices of everyday people grappling with addiction, families torn apart, and those who are fighting for their loved ones are woven into these recommendations. Let's be clear. The focus of our work has always been the residents of New Jersey. My own story fuels my belief in these recommendations. You see, I'm one of 15 children who were born to parents who suffered from substance use disorder. Like too many others, my siblings and I were taken away, put into foster care system, while other families stayed together, simply because our parents needed help. It was confusing and heartbreaking. I grew up in this city, the third oldest city in the country, and I grew up in Seth Boynton Projects, now the home of Lionsgate's movie studios. And often I feel like my life is a movie. I'm here today because of the strength of so many people that struggle and continues to struggle with substance use disorder. Yet far too many other residents aren't as fortunate as I am. That's why our recommendations, our proposals seek to reshape the system, supporting families struggling with addiction so that they can stay together in this state of New Jersey. Again, as we finalize and present the recommendations today to the state of New Jersey, we carry the voices of New Jerseyans on our shoulders. Our recommendations, your recommendations, New Jersey, have been methodically designed to support the proven prevention strategies, expand access to life-saving treatment, and foster stronger communities. We believe New Jersey can be a more resilient and hopeful state for everyone impacted by the opioid crisis. And lastly, I would say, New Jersey, we heard you, we're listening, we will continue to listen, but we need everyone to play their part. And with that, thank you guys so much. We're really excited about the future of New Jersey. Thank you, Governor.
I'm sitting there thinking, thank God I spoke before Solomon. I don't want to have to follow that act. But thank you for your lived experience, for your experience with an input on this council, and for the street teams and everything else you do. So God bless you and your family. As they say in Hollywood, it's a wrap. I want to thank Brian and his team for hosting us so graciously. Solomon, as I mentioned, both Sarah and Caitlin, for your leadership, to the members of the council, to the folks who have made this recommendation, this program come to life. Thanks to each and every one of you. I don't want to end on a, as they say, a B flat, but the fact of the matter is I want to underscore what someone said, I think it was Caitlin. The good news is the numbers are going down. There's undeniably good news there. But the challenge is the numbers remain far too high. These are each and every one of them precious lives, and the demographic is now shifting with much more force into the black and brown communities of this state. So we cannot relent, and I promise you, I know collectively I say on behalf of all of us, we will not relent. God bless you and thank you.